Good afternoon, and I really want to thank ICSSPE for this invitation. It is really an honor for us as Region 5 in Africa to be joining with everyone within the global community as we are all trying to find ways of responding and surviving as a sport movement out of this pandemic that has taken all of us by great surprise. I will delve very quickly. I'm going to skip a number of other areas because my predecessors have spoken about most of the things. But just to quickly say that within our region as well, we have 10 member countries in Southern Africa. Africa is divided, like you have heard, into 5 regions, and we are in the 5th region, which is with 10 member countries. And just like everyone else, sport has been the hardest hit industry in our region. Very different interventions have been made. Our responsibility as Region 5 is to coordinate a sort of a holistic approach to ensure that all the member countries do run sport and sport for development programs, especially under these conditions which have come to all of us. And what we have noticed as well is that as we work towards that, we've seen quite a number of variations to frameworks by different member countries globally and also in Africa on their sport regulations in the wake of this pandemic, where we would like to be as cautious as possible to avoid any spikes of reinfection. And our view has been that the impact has been quite broad-based and specific in other areas. So the impact of COVID-19 within our region, we tried to look at it from various angles, and we looked into how it has affected our attainment of certain global agendas. And in particular, we looked at 3 very critical categories, which is participation in organized sport and physical activity, which has impacted Sustainable Development Goal number 3 of the UN, as well as Agenda 2063 Goal number 1 and 3, which talks about well-being, health and well-being of citizens, as well as policy priority number 2.1 of the Kazan Action Plan, which I'm sure you will see also when we post the full detail of this presentation. There's been also an impact in our region on the social dimension, which looks into what my predecessors have also spoken about, particularly when I was following the presentation by Dr. David, the issue of inclusion and equality, even here in the region. We have seen a huge impact of COVID-19 in our attainment of inclusion agenda, especially if you look at Sustainable Development Goal number 5 of the UN, as well as goals number 17 and 18 of Agenda 2063, which is the framework for Africa's policy in directing our operations. And this specifically looks into inclusion of women and the young people or the youth into all facets of society, as well as Kazan Action Plan priority number 1.5. And finally, there is also a huge impact in the Southern African region on the economic side. COVID-19 has really had a huge impact on economic development and employment, particularly when we look at our attempts to attain the Sustainable Development Goal number 8, Agenda 2063 Goal number 4 and 18, which is looking at economic empowerment and economic transformation of our region, and priority area number 2.5 of the Kazan Action Plan. And there is also governance of sport, where we have seen, while it is a good thing that most of international federations have introduced recovery packages to assist athletes and sports federations to try and recover during this period, we have also seen the other side of the impact of COVID-19. In the area of governance of sport, there's been a number of conflict relating to how the packages have been distributed, with some sections of society feeling as well left out. You just heard as well from Dr. Aleg when he presented the issue of exclusion of certain constituencies in society. So that has exposed the need for us to do a lot of work in the area of governance. And that has been a key issue. Now, as a region, what we tried to do was then to make a risk assessment in our approach to try and get sport back, and also to determine whether we should suspend activities or cancel them in total. And we came up with support from the World Health Organization with a risk tool that has got key fundamental questions that we look at, and any score into this tool will determine the risk level of any event. Then it will determine whether we should cancel or we should postpone the event. So if any event is to be mapped against this assessment tool, the responses to that will then be looked into a mitigation matrix, which then tells us if the total of those 4 questions, the total risk score is 4, we then look at other elements which are defined in these 4 columns, and any activity that falls in the red out of this matrix, that activity is cancelled. And we look into any moderate to very high risk matrix is a cancellation, and low risk, which is a yellow, we then postpone the event, and green is only when we can allow member countries to consider how to make a calculated return to sport. So that's a framework which we did develop with support from the World Health Organization in just in terms of the key itself, what I was just talking about, what red means, green means, and amber means. And so that led to an effect to a lot of our events here. If you can see, most of our events, we do run regional marathons, we've got regional annual sports awards. We have a mobility exchange program in collaboration with TAFISA, who are our partners, where we have 10 young women, female leaders from Africa who have to exchange leadership and cultural heritage knowledge with 10 compatriots from Europe. That project was affected because of restricted travel and all the other elements. We also have the Women Leadership Program and the games that we host every 2 years, which were scheduled to be hosted in December 2020 in Lesotho. So all these were affected. And there is a number of events that were also affected, mostly, most of them being meetings and all that. So how did we respond to these activities as a region in terms of the impact of COVID-19? There's been a number of responses that we've made, and we classified these responses into 5 categories, being prevention and containment measures, as well as advocacy and communication, as well as advice and guidance. We also had the category on economic support packages and return to sport. I'm not going to talk to each one of these 5, but I'm just going to talk about 1 and 5, just like my colleague, Professor Dr. Simon did. I will also do the same. I will just talk about 1 and 5, which is prevention and containment. And under prevention and containment, we then tried to prevent escalation of infection, and we tried to flatten the curve of infection by introducing telecommuting. We had to ensure that we get into policy formulation to make sure that our staff and other sports delivery agencies do not expose themselves. And we also then went into digital platforms as well, virtual meetings and other such activities. Yes, we've encountered quite a number of challenges, just like Dr. Legg also mentioned, the issues to do with connectivity and access to high-speed connectivity. That became quite a challenge. I will go straight to the last one, which is the 5th category, which is return to sport, where in response, we worked with the World Health Organization to develop return to sport provisional guidelines, which were to try and help because of the diversity of our member countries. We wanted to create a regional framework that can be used by the member countries to develop their own regional return to sport guidelines. So we worked with the World Health Organization, and we are now in the advanced stages of putting together a team which is comprising of Africa Center for Disease Control, the Ministries of Health, and the World Health Organization, including the sport movement, to then come up with a regional framework which will then be used as a framework to be considered by member countries as they develop their own regulations. So as we did that, we then realized in our view that we needed to have some practical interventions, and some of these interventions in those 5 areas that we talked about, we then made those interventions in 3 levels. 1, interventions that looked into the systems and population level change. Again, borrowing quite a lot from our interaction with the Commonwealth Secretariat, we came up with these 3 levels of interventions practically to address our systems, because we realized that COVID-19 exposed our systems quite a lot in terms of how do we respond, how do we get athletes supported, and how do we get sport itself to continue sustaining. So we had to look into systems and population level change. We had to look at institutional level change, because again, most institutions were not ready. And finally, the community level change. I will not go into each one of these, but I'll just then talk about the systems level change, which is linked to the 5 interventions, types of interventions I mentioned earlier on when I talked about how we have intervened. So under the systems level, we looked into the issue of developing universally accepted protocols that can help in governing bodies when they look into things like cross-border sports activities, because if one country returns to sport and the rest of the 10 countries are not, there is no way they can compete. So we needed to look into how we can create universally accepted protocols. And our ministers are looking into these protocols that we are looking at, and they are addressing what I mentioned as prevention and containment measures. Then we are still at systems level. There is a countries and confederations of sport guidelines to economic packages, which is also addressing the economic support packages that we mentioned earlier on in type of responses. And then finally, under that systems is the investment in safe ways of keeping citizens active. We noticed that while we focus on COVID-19, there is a danger, a risk of forgetting that there are other lifestyle illnesses that can spike out of sedentary lifestyles. Things like non-communicable diseases, which we may forget while we all keep focus on dousing the fire of COVID-19. So we have looked into the systems that can address populations on the containment of such spikes. So we have introduced some online as well as physical at-home safe sport activities and various other platforms. The Morning Doctor program that we run every Wednesday, the aerobic sessions that we run, which people can have at home, which is an at-home fitness level. So like I said, I'm not going to go into all the trends. Just concluding by saying that COVID-19, thank you. Just concluding that COVID-19 remains in our midst. New measures of doing business are required, and our responses need to be customized so that we don't have a one-size-fits-all. And sports benefit need to be preserved in spite of the challenges that we face. And there will be need to continue making informed decisions to freeze sport or to return to sport. Otherwise, thank you very much for this opportunity, and we wish everyone very well. I will be following as well other presenters and discussions out